Good day, everyone. I am Harry, your moderator for this webinar. I welcome everyone for today's webinar, which is called 2021 Uro-Gynecological Coding for Urologists. So now I would like to introduce our presenter for today, Dr. Michael A. Ferragamo. He is my favorite speaker. Let's go with the bio. So Dr. Michael A. Ferragamo Jr. is MD, FACS, is a former Chief of Urology of Hampstead Medical Center and of Franklin Medical Center of Long Island, New York, and presently is Assistant Clinical Professor of Urology, State University of New York. Dr. Ferragamo is a consulting editor for Urology Coding Alert and is a coding consultant for many private practices across the United States. So I would like to hand over the floor back to our speaker. Over to you, Dr. Ferragamo.
Thank you very much, Harry. Thank you for that introduction, and welcome to my friends and colleagues and loyal subscribers to Urology Coding Alert. And I'd like to just start off for a short time talking a little bit about the economics of urogynecology. The annual deductible for 2021 Part B Medicare will be $203. That's an increase of $5 or 2.5% from $198, which was the deductible in 2020. Now, we do have a change in the conversion factor. Now, the conversion factor is a number that changes or converts the relative value units of the things we do and services that we provide into dollars and cents. So it is an important conversion factor. Now, I'd like to show you new patient office visits unadjusted fee schedule. And let's look at the payments that we're going to receive in 2021. Facility charges in the hospital, procedures done in the hospital, and these are frequent urogynecology procedures. And as you can see, when we do these procedures in the hospital, we will be paid a little bit less. You can see percent change. They're all negative, a little bit less. So when we look at these 2021 payment changes for urogynecology by the place of service, POS summary, and let's look at the 2021 new and deleted CPT code. We do have a new add-on code, 57465, which is an add-on code, and you can tell it's an add-on because there's a plus in front of the code. And I want to just bring up and tell you that when we talk about laparoscopic robotic procedure codes for urogynecology, there were no new, deleted, or revised laparoscopic robotic codes for urogynecology for 2021 in the female genital system, 56405 to 58999. That's some coding tips that we received from the American Urogynecology Society, the AUGS. I'd like to review with you some urogynecology diagnoses that you probably will use very often. These diagnoses come from Chapter 14 of the ICD-10-CM Manual. Look at some other Chapter 14 ICD-10-CM Manual, Uro-Gynecological diagnosis. Vaginal procedures that you perform under anesthesia. And let's look again at lesions of the vulva and labia, and we're going to look at a sebaceous cyst and the removal of a sebaceous cyst or an epidermal cyst. And this is something that's not done by many urogynecologists or actually surgeons or urologists. It's the correct measuring for lesion removal. And let's look at how we code for extraction, fluid extraction, say from an ovarian cyst. And let's look at this plastic operation that is being performed more frequently, a labioplasty. And we have information on coding from the AMA and from ACOG. Other chargeable services, when you use one of the three above codes, you may do a suprapubic cystotomy or a punch cystotomy. You may do an injection procedure for a cystogram, and you may interpret the cystogram, the 74430 modifier 26 interpretation of the cystogram, but you must interpret three views. Usually it would be an anterior-posterior view, a lateral view, a drainage view. And let's look at urogynecology coding for laparoscopy and robotic procedures. Usually the laparoscopic procedures include robotic assistance when performed. And let's look at laparoscopic biopsy of the ovary, fallopian tube, retroperitoneal mass, or pelvic lymph nodes. Now, for this laparoscopic biopsy, use the code 49321, which is laparoscopy surgical with biopsy, single or multiple. And I want to talk to you a little bit about what comes up very often with questions, and that is, how do you code Pessary coding? Well, use the code 57160. Now, if you patient comes in and you remove the Pessary, you examine the patient, you clean the Pessary, and you reinsert the same Pessary. Don't bill the 57160. Bill the office visit, the 99211, the 99215. Here we have the Uro-Gynecology Pessary coding for Medicare. Here we had an office visit, 99214. We did a urine analysis, 81001, and we fitted, measured, and placed a new Pessary. That's code 57160. Now that's a surgical code, and you need to, if you want to get paid for your office visit, and you must add modifier 25 to that visit. And then you bill your local carrier, in this case Medicare, for the Pessary as a supply, A4562. And you should be paid for that, these four charges. Well, thank you, Harry, for holding the conference. And if you run into additional questions that come up that you didn't ask or you weren't aware of, you can always email me the question, and I will answer your question usually within 24 hours. Okay, so thank you all for your attendance, and we'll see you next time.